things that have changed. There's so many desires that women physicians want specific to us. And I'd like to bring on Dr. Erica Howe again because of that. My name is Dr. Elsie Coe. I'm the founder and CEO of Lead Physician Online Leadership Program for physicians. I'm also the Chief Medical Officer of American Endovascular and Amputation Prevention. Please go to our YouTube channel and subscribe so you can be notified every time there's a video that comes on. Again, now I'm going to bring on Erica Howe. She's the founder of Women Physician Wellness Conference. And, there's one coming right up. So this is timely. And she's been so instrumental in helping so many women physicians. And you know what? She's morphed herself to provide content that's specific to women, even during the changing times. So let's bring her on right now. Erica, thank you so much for being here again.
Thank you so much for having me, Elsie. It's so great to see you.
I know. Erica, thank you. So, I noticed that when you have these conferences and you have 3 conferences each year now, and you're not a person who stays static. You're somebody who wants to make this better and better all the time. There's the one that's coming up. It's at the Grand Cayman, February 23rd to 25, the Women's Physicians Wellness Conference, WPW. We'll talk about the website in just a second. Tell us a little bit about how the content has morphed and what do you think women want right now, women physicians?
Absolutely. And it really does. You're right. It morphs so much. We try to really be flexible with our curriculum each year and even each conference. So each of the 3 conferences serve different goals, and we can talk about that in a minute. But when we talk about what women physicians need, we really need to talk about what they're struggling with right now. And I think there are 3 main issues that women physicians have really had to address in the past few years with the pandemic and even since the pandemic. The first is the daily grind. I think we've all experienced just the nonstop in and out clinical work that is increasing as far as patient volumes, but also complexity of patients. I mean, we also experienced really having to diagnose a disease that was new to every single one of us in the world. So that it was extra taxing. We were seeing different complications and different morbidities and mortalities all associated with this new disease. And then we got to struggle with going home at the end of the day and still having all the challenges with home life that were really now piled on us, where we may have before the pandemic been delegating or offloading to a partner or a family member. And now we just couldn't do any of that. And with that daily grind, both inside clinical medicine and then, of course, outside of it in our home lives, we also had a lot of isolation. There was certainly the social distancing, but I think, many of us, one of the benefits of having a small community of women physicians is that we lean on each other and we can be very personal with each other and share really some serious vulnerabilities. That social distancing really affected that. And I don't know that that's entirely recovered since that time. So that's probably number 1, the daily grind and isolation. But then there was also the moral injury that I think we have all experienced those patients before that don't trust us, don't believe what we're saying, but that was often few and far between, or it was something that we could kind of talk through with those patients. And suddenly with the pandemic, we saw a really big rise in that distrust and even people thinking that we were out to get them and that we were malicious in our goals and not that we were, the doctor that had signed up to give up our 20s and to work, our butts off in order to help them and to really make a difference in patients' lives. They actually thought that, we were trying to do a disservice to them. And I think that has affected a lot of us, and we were seeing it in bulk. So I think that's something that we are still recovering from and trying to figure out where do we fit in medicine, given maybe a new population of patients that we're taking care of with new agendas and a new way of seeing us as physicians. And then I think the third thing is, okay, like we just went through this crazy pandemic. I was burnt out before then. The studies have showed before the pandemic, we had between like a 67 and a 75% burnout rate among women physicians. And then there was a pandemic and we didn't get a chance to rest, And so how do we come out of that saying, I felt burnout before the pandemic. And then I was there was a demand for me to work and to show up even when I was exhausted because these patients needed me. And I still haven't taken a minute to breathe for myself. How do I start to take a step back again and reprioritize myself? And that's really where WPW comes into play, to kind of give you a chance to reframe some of this and ask yourself some of those really hard questions and start to learn and explore and reflect.
Right. And I understand you have 3 different, ones. Tell us a little bit about the climb that's coming up. You call
Yep.
it climb, it's at the Grand Caymans. Tell us a little bit about why this is different, and I love your website. People should go to the website. Tell us what the website's called, and then tell us about the climb.
Yep. The website is womenphysicians wellness.com. And then if you want to look specifically into the climb conference in Grand Cayman, that's backslash climb. And so that's the first one that's coming up this year. And we start off with climb really being focused on career development, and thus the word climb. It gives you a chance to address some of these struggles that we've had. How am I going to really take a minute to reflect? And one of the ways we think this is really important is to step away from your daily clinical and home life. There is a reason I have been known to say that we don't hold this in Cleveland, because I don't want you to be charting at night. I want you to really step away, take a break, and really reflect on where you are in your career,
In a
where you
beautiful
want to go.
location.
Yeah, and the location helps. So,
Yeah.
nice tropical location, it doesn't hurt. I do. I feel like we don't rest. We don't take our PTO. This is a chance to really step away and say, okay, I've been in that daily grind. I haven't taken a minute for myself in years. Where am I going? Am I in the direction that I want to head with my clinical career, or maybe even beyond that? Am I doing the things that are really going to serve me and fit that vision? Do I even have a vision for where I want to go next? So that's the
Exactly.
point of climb, is career development and leadership development. How can I move to that next step in my career and even beyond?
Right, and I love what you say on your website is it's not just bringing the top speakers to on leadership and development self-care, but it's also, allowing the wellness piece built into the conference. So in
Yep.
the morning, every morning you have, yoga and meditation, sprinkled into it, and you give people the time to even just, relax afterwards. So it's not all day long of looking
Yes.
outside and seeing the sun and the beach while you're indoors, like
I
most
have
conferences that we go to.
I have been to that conference before. I never saw that island except for through a glass window, and I was freezing the whole time.
Yeah,
Elsie knows you have been there. You have been a speaker for me
I've
so many
been
times. I've been so honored to have you talk to us.
and you got some amazing speakers. Yeah,
And
and that's
honestly, the speakers are fantastic, and you are one of them. Equally important is that this is not a lecture. These are all discussion based. So one of the most important things is that we sit everyone at assigned seating at a round table. You're going to get to meet new people, and you're going to be able to share your story and your strategies and your struggles along the way. And we're really building in discussion moments in every session and every speaker session. So we want you to get to know the people at your table each day, and to really start to delve into some of the things that you've done that have worked for you that you can share with others, and some of the things that, boy, I'm really hitting a wall here, I don't know what to do next. So
right.
I think those tabletop discussions are one of the most important aspects. And then you're right, we have afternoons off. I used to go to an amazing leadership conference, and it was 14 hours a day, and I just felt like I need a break. I need a breather to take this information I'm learning and to really reflect on it and apply it. And actually, I used to teach a lot in medical education, and that is one of the things that solidifies knowledge the most, is stepping away from that learning moment and reflecting, and then actually figuring out how you're going to apply that new information in your life. So that's what we're trying to give you. Now, if you do that on a beach or a boat, I'm totally fine with that. So
Yes, and I just wanna recognize that some of the testimonials you got, I mean, this is where we're all outside and there's a reception that you have, you're indoors and outdoors, and
absolutely.
you're creating friendships, and you're talking about the same issues that you've been dealing with, and you help each other, and people build lifelong friendships there. Someone said, "Love the support of women in this environment. I felt comfortable sharing my own fears and insecurities and learning from others. Thank you for making this happen. So grateful." And another person said, "Really great experience. Excellent way to re-energize by connecting with other physicians who are struggling with similar issues. Speakers were spot on and engaging. Awesome location, hotel, amazing." And I immediately came home and composed an email stating that I would like a meeting time changed, and it was. Previously, I would have just suffered through it. My family would have suffered, and I would have been upset. But the conference helped me get the confidence and wording to do this. So amazing, right?
Yep. And that's exactly what it's supposed to be. This is not just kind of ethereal talk about, how to, address some of these issues. We want specific strategies that you can walk out the door with and immediately apply. And again, that's why those afternoons are free. If you want to go write that email, you can write it in the session. You can write it directly after. We're not looking for kind of just theories. We want actual strategies that have worked for other women physicians. We only have women physician speakers, and we make sure that they really have something important to share that is going to bolster our careers in medicine and then certainly our personal lives beyond.
Right. So go to www.womenphysicianwellness with an S, physicianswellness.com/climb. The last day to sign up is January 23rd. It's only a couple weeks away. So join us there. Let's meet. Let's have some fun.
Yeah, Lucy's going to be there.
And lastly, what are the other two conferences that are coming up this year so people know? There's this is the Grand Cayman one, but then you have one in Aruba and Amelia Island.
Yes, that's absolutely right. So at the beginning of May, we have one in Aruba. That one is focused more on the burnout, gaining resiliency back, and some of the personal development that we also need to do. And then Amelia Island is for women who cannot travel outside the continental US in order to get their CME. We have up to 18 AMA, PRA, Category 1 CME credits for each of the conferences. So if you can't leave the US in order to claim those, we want to give you an opportunity to join us at something that's stateside. So that one's in Amelia Island, Florida. That one, we take speakers from both of the other conferences. And so you get a little bit of both conferences in Amelia Island.
That's beautiful.
That's in August.
Thank you so much. That's so good. Thank you for being on here today with us again. And I look forward to doing some more of these little podcasts with you to understand what's coming up with what you're doing. And thank you so much for what you do, Erica. I really appreciate it. You really help making an impact and helping women physicians, and we really need it. Thank you everybody for listening. My name is Dr. Elsie Coe. If you have a topic on physician leadership, please reach out to me. You don't have to be a physician at info@drelsiecoe.com, and join us for leadership coaching. If you're looking for personal development and leadership coaching, go to our website at leadphysician.org. Any last words for us, Erica, as we close?
I'm so grateful for you. I think this speaks to the community that we've built within WPW. The fact that many of the speakers and the attendees that have come to WPW have become some of my closest friends, including you, Elsie. You just do such incredible work, and really gaining those skills in leadership is such a crucial part of us kind of gaining the lead in making some of the changes in medicine that we need to see. So please, if you're thinking about signing up with Elsie for some leadership coaching, what she teaches is so valuable. So just kudos to you. I think you're doing incredible things as well. So
thank you so much, Erica. Blessings to you. Take care, everybody. Until next Sunday.